Hello and good afternoon, everyone. Thank you so much for joining me today. Today's webinar, we're going to cover meaningful use for 2016 and on. Some of the things that we're going to cover, of course, is the objectives that everyone should be meeting, as well as the incentive and any penalties. So let's start with that. So those who are participating now will not be receiving any incentive for successfully attesting for meaningful use. That has been the case since I want to say last year, where now you're no longer really trying to achieve meaningful use for an incentive. Now it's just more so for avoiding a penalty. Now, of course, successful attestations and completing all 3 stages of meaningful use will prevent these penalties. So in other words, to kind of clarify that a little further, once you start meaningful use, it's not like 1 year you just successfully attest and then that's it, you're done. For those who have been participating or have joined from 2015 and before, you should know by now that if you do 1 year, you have to, of course, complete all of the years, required of you for meaningful use. So meaningful use came in 3 stages, so you would have to complete all 3 stages and then, you would be done with meaningful use. Now, as far as the penalties, in 2015, this is based off of 2014 participation, 1% of Medicare reimbursements would be what would be the penalty. 2016, based off of your 2015 participation, would be 2% of Medicare reimbursements, and then 2017, based off of 2016 participation, 3% of Medicare reimbursements would then be your penalty. Now, since we're talking about penalties, I do want to introduce or kind of talk about a little bit about PQRS. This is not the main purpose of the webinar, but I can't help but to mention it. There are a lot of questions of PQRS. Once upon a time, it used to be kind of started part of meaningful use. You could report PQRS through the attestation website along with clinical quality measures. Since then, though, this has been probably 2 years now that it hasn't done that. Now, PQRS is separate from meaningful use, so one doesn't really have to do with the other. Both are coming from Medicare. So for PQRS specifically, this is only for Medicare patients that you should be reporting this, versus meaningful use is actually for everyone. So if you are participating with meaningful use, or this is your first time participating with meaningful use, these objectives that you should follow is going to actually be all of your patients that you'll see during the reporting period, versus with PQRS, it's only Medicare patients. There are, for this year 2016, just like last year, you do have to select 9 measures for PQRS. There are 9 claim-based measures that you can report, and you should be reporting these measures for more than 50% of the time by including the appropriate CPT-2 code in the claims. CPT-2, PQRS, NQF, they're all one and the same for the most part, so these are the codes that you want to enter on your exam. There is information on our knowledge base articles or videos about PQRS and how to add those into your exam. It's actually really simple. There's a lot of logic that was built into the PQRS button, specifically in the exam, that is going to let you know which of these patients actually meet. Of course, your Medicare patients meet the criteria that it's looking for PQRS. Now, some recommended measures, since there's a lot of PQRS codes out there, and the ones that we've actually included, in our exams as far as what would be available or what codes would be available based off the patient you saw. So these are the recommended measures. So primary open-angle glaucoma, age-related macular degeneration, diabetic retinopathy, you have diabetes eye exam, and these are all by the appropriate NQF numbers or measures. You also have counseling on antioxidant supplements. Another measure here for primary open-angle glaucoma, preventive care and screening, tobacco use screening and cessation intervention. And then you also have some cross-cutting measure sets. So you can see here that these are all claim-based PQRS codes that you could, at submit via your claim. So you do have 9 measures here that you can add. Now, as far as the attestation, going back to meaningful use, and any questions that you guys will have, I'll definitely answer towards the end of it. So if you do have any, during the presentation, have any questions, there's a chat box, so feel free to ask those questions. I'll address them at the very end of the presentation. Now, attestation, this is of course for clinical quality measures and also meaningful use. This is now separate from PQRS. The way that you attest is you're actually going to go to the attestation and registration portal on CMS. If you just go to the CMS website, type in attestation or registration, it should give you the proper link. You can also go to our website, our support website, and we do have a section dedicated for meaningful use, and it does have the link for the registration and the attestation portal. It also does have a little quick guide on how to register for CMS or for the attestation portal. Now, part of the attestation, once you log into this portal, is now you're going to enter your numerators and denominators. Now, all the objectives, they're either in the form of yes or no questions, or they're going to be in the form of those numerator denominators. You'll be able to generate the report for meaningful use as far as the numerators and denominators. You should know if you have done all the other objectives as far as those yes or no questions. Now, once a successful online submission is completed, you will receive a summary of the attestation. It will also tell you right off the bat if you did pass it or if you did fail it. And I believe that you actually have 2 chances with the attestation to enter your numbers. Now, clinical quality measures. I'm getting a lot of questions as well for clinical quality measures along with PQRS. Some people actually think they're one and the same, so I do want to clarify and stress that clinical quality measures and PQRS are 2 completely different programs, I guess you can call them, although you will notice that some of the measures are actually very similar. Like, for example, they both share some diabetic retinopathy measures, primary open angle measures, tobacco measures as well. But with clinical quality measures, though, this is something that you would go ahead and report via the attestation. So when you report for meaningful use for those 10 objectives, you're also going to have a chance to attest for clinical quality measures. This, once again, you'll be reporting this through the web-based system. And just like the objectives for meaningful use, it is going to come in the form of numerators and denominators, as well as exceptions and exclusions. When you generate the meaningful use report for clinical quality measures in My Vision Express, it's going to give you what those numbers are. Now, I also want to stress with clinical quality measures, I have a lot of customers who, when they generate the report, they see a lot of zeros, and that's usually the case. With these measures, it's not looking at all of your patients. It's actually looking at specific types of patients. It's also looking at specific type of office visits, patient age range, or even diagnosis selected in the exam. Now, we do have a guide for clinical quality measures on how to satisfy each one of those measures if they do relate to your scope of practice. Keep in mind, some of these clinical quality measures don't, but you would still need to report the numbers. I also want to stress, too, that with clinical quality measures, it's not a pass-fail. So, which is, of course, different from your 10 objectives. If you fail that numerator denominator, or if you don't meet that threshold, then that will count as an automatic fail, but not the case with clinical quality measures. So if you get a denominator of 0, a numerator of 0, then that's fine. It's just that you don't have a patient that meets the criteria for that measure. Of course, if you have a denominator, but you don't have a numerator, it might be because you didn't take those extra steps to calculate that numerator, which also may not be part of your daily routine or part of your scope of practice. So I do want to clarify that. And also one last thing too, as far as audits go, because I'm huge on audits and meaningful use audits do happen, I have not seen a clinical quality measure be audited. They mainly concentrate on the objectives. Because once again, with this, clinical quality measures, they're just simply trying to look at the numbers based off of your patient demographic. Okay, now as far as the reporting period, so there were some changes from October of last year. So last year, everyone was a 90-day reporting period, regardless if it was your first time doing meaningful use or your fifth time doing, that's impossible, third time doing meaningful use. Now, for this year, if you are a first-time participant, then it is a 90-day reporting period. But those who have participated prior, even if it was just 1 year prior, you would still be a non-first-time eligible provider, and it would be the entire year that you would do meaningful use, these 10 objectives. So let's get into the 10 objectives. And once again, and one thing also I want to clarify as well, with the new changes last year, they did change the structure of meaningful use. So rather than, depending what stage you were on, if it was rather than 17 core and 6 menu items, now it's just 10 set of objectives. What they also did last year was for those who were scheduled for stage 1, they had some stage 1 alternates for those 10 objectives. So they had either an exclusion you can take if you weren't scheduled for stage 2, or you can report to a measure but with a lower threshold percentage. But this year, it's not the case. So this year, everyone is doing the exact same 10 objectives. There is no stage 1 alternates or anything like that, so we're all meeting the same 10 objectives, the same threshold, and everyone will be eligible for the exact same exclusions. So starting with the first objective, this is going to be risk analysis. Now, this is an objective that has been around from the very beginning. And this is pretty much just making sure that you run a risk analysis in your office. Now, there are a couple different ways that you can do this. You can either contact your regional extension center. Every state has one, their local regional extension center. These companies, with sometimes a price, they'll be able to run the risk analysis for you. And that's pretty much making sure that you are protecting health information, patient health information. So making sure, I want to say it, I don't want to simplify it as saying, like a HIPAA analysis, but very similar to it. Now, another thing that you can also do, there's companies out there other than the Regional Extension Center. I know there's a company called Bits and Bytes, and they can also do the risk analysis, of course, at a cost per provider. There's also tools online. I think High Tech probably has one out there as well. Their CMS has like a risk analysis guide or toolkit that you guys can also utilize. Lastly, we also have on our website, if you go to our support website, go to our meaningful use section or type in risk analysis, we do have a packet. It's 39 pages. And this, of course, is coming from all the rules and regulations from CMS, how we built this packet, but it's something for you guys to print out and fill, and that way you'll be able to fill out that risk analysis. One thing that I would highly recommend as far as the risk analysis is whenever you do it for any year, either now or even prior, make sure that you have either someone who performed it, an IT person write out a documentation that they did perform the risk analysis, any risk that they did find, how they were able to, further prevent, any risk that they may have found, and also some kind of proof that it actually was done. Once again, the person who did the risk analysis, if they could sign off on it, write documentation on when it was completed. One thing that you want to make sure you do with the risk analysis as well is make sure that it's completed either during, prior, or right before you attest. The moment that you try and complete it after you attest, if you were to be audited, if they saw that the date of the completion was after your attestation, then that may be a cause to reject the audit or to fail the audit. Now, the second measure here, or second objective, is clinical decision support rules. So this is actually broken up into two different measures. The first measure is asking that you implement 5 clinical decision support interventions. related to 4 or more clinical quality measures at a relevant point in patient care for the entire reporting period. Now, one thing that you do want to look at when you do set up these alerts is look at the clinical quality measures and look at what type of measures they're looking for. Examples, really great examples would be primary open-angle glaucoma, diabetic retinopathy, diabetes, and you could use the same diagnosis if you have different alerts set up. And I'll show you in a moment how to actually set up one of those alerts. Now, the second measure is asking that you have enabled and implemented the functionality for drug-drug and drug allergy interaction checks for the entire reporting period. Now, this is asking that you have, essentially, you have Dr. First, which is the e-prescribe company that we have. Now, if you don't have Dr. First through us or an e-prescribe company through us, I would still recommend that you get an e-prescribe company that does have this functionality in order to meet this measure. Now, once you have e-prescribe and you have that functionality already enabled, which comes in hand, if you have Dr. First, you have this already enabled. Then you've already satisfied this measure. Once again, I'm huge on audits, and more proof the better. So I would, to prevent any future audits or in case of an audit, to satisfy the first and the second measure, I would actually take screenshots of the first measure being set up, and also the second measure. I would have, if let's say you have an example that you can demonstrate through e-prescribe and have that message of that drug-drug or drug allergy interaction check, I would take a screenshot of that. I would also, while you take the screenshot, usually on the bottom right hand of the corner, you have the date and the time. Make sure that you have a date, like a date stamp. So that way you can also further prove that this was done during the reporting period. Now, there is an exclusion for this measure, specifically for the second measure. So if within this reporting period, if you so happen to write less than 100 medications, then you can exclude yourself from the second measure, but not the first one. So I'm going to exit out of my PowerPoint presentation for a moment, and let's go into MVE. I just want to show you where you would go to set up that alert. So we're going to go to File, we're going to go to Setup, we're going to go to Exam, and then we're going to go to Alerts. So remember, you need 5 of these alerts. Now, I've got one example here. If you want to add any additional alerts, you're going to select Add, which will give you a new line item. And then on the bottom is where you're going to actually add your descriptions. So in this case, I entered description of glaucoma. My message that I want to pop up is check IOP. Keep in mind that any message, you can write any message on this section. Check IOP, have patient return in 3 months, whatever the case is. Now on the bottom, you can specify an age range. You can also specify an ethnicity and a race. So now that I've done this, it's now looking, I've set it up, so now it's looking at a specific type of patient. So if I do have a patient who is over 40, if I entered a specific ethnicity and race, then it's only looking at those type of patients. Now, I need something that's going to trigger this message that I just created. So that's where I'm going to go to the Details button. And when I go here, I'm going to add a problem. So that's going to be my trigger. And I already have glaucoma here. So the way that this would work is if I had this patient that, match the criteria that I specified here, and I entered glaucoma in their problems list, this message check IOP is going to appear. Once again, you do need 5 of these, and once again, I would suggest that once these are set up, to take a screenshot of it. All right, so that's going to be objective 2. Now, objective 3 and actually objective 4, they both kind of go hand in hand. Starting with CPOE, this is just asking that you use computerized provider order entry for medication, lab, radiology orders directly entered by any licensed healthcare professional who can enter orders into the medical record per state, local, and professional guidelines. Now, the measure is looking at more than 60% of medications, 30% of laboratory, 30% of radiology orders. The exclusion is if the EP writes fewer than 100 medications, radiology, or laboratory orders during the reporting period. With that exclusion, most customers probably end up taking the exclusion for the laboratory and the radiology, since sometimes it doesn't, most of the time, it doesn't fall into their scope of practice. As far as the medications goes, to satisfy this, if you have Dr. First, which is the e-prescribe company that we utilize, then when you prescribe a medication through Dr. First, it's actually going to create two different medications. One is going to be the ordered medication, which would be satisfying CPOE, and the other one's going to be the actual active medication that you prescribed. Now, the second one, the active medication, is actually going to satisfy e-prescribe here. So you can see that when you do prescribe any medications through e-prescribe, you're already satisfying three objectives. So you're satisfying that drug-drug interaction check because you have Dr. First, you're satisfying CPOE, and you're satisfying e-prescribe. If you're curious as far as where that second prescription goes, let me just pull up a patient here, so that way you can go ahead and look for it. It's in the medications tab, and you're going to notice there's some radio buttons and a checkbox that says show orders. So let's use this patient here for those Star Wars fans. And let's go into health tab. Now, here in the medications, if you ever do want to look at that order, and this is something that automatically creates itself when you prescribe the prescription through e-prescribe, when you select the all radio button and then select show orders, then it's going to go ahead and show you that ordered medication. All right, so now let's move on to Objective 5, which is health information exchange. The EP who transitions their patient to another setting of care or provider of care or refers their patient to another provider of care should provide summary of care record for each transition of care or referral. Now the measure is the EP who transitions or refers their patients to another setting of care or provider of care must use a certified health record to create a summary of care record and electronically transmit such summary to receiving. Actually, we can go ahead and erase that for that second measure. This has been changed, so now it's not requiring, or no, that was actually correct. Transmit such summary to receiving provider for more than 10% of transitions of care referrals. The exclusion here is if you were not the recipient of any transition of care during the EHR reporting period. Now, in order to satisfy this objective, if you are going to be referring a patient out to another doctor, let's go ahead and exit out of this. And let's go back into MBE. Now I'm going to go ahead and go actually into an exam. Now to increment the denominator for this one, you do want to make sure that if you do refer a patient out to another doctor, you do want to make sure that you record that in the refer to and reason section in the assessment tab. So that's going to be this section right over here, the refer to and reason. Now, for your numerator, what you want to do is go into the Health tab, and we're going to go to the HL7 CCD CCR sub-tab. Now, I do want to create is a transition of care summary. Once this has been created, I want to go ahead and upload this to the patient, to the global portal. Now, the transition and care summary and the clinical summary, you'll notice that they're both very similar. If you feel like the transition of care summary doesn't give you enough information, which is probably a majority of how people feel when they look at the actual document, keep in mind it's only really pulling in information from the Health tab, but if you, and I know other doctors like to use an actual referral letter, which gives you a lot more information. If you still want to continue with using those types of letters, definitely go ahead and do so, because just from my experience in looking at the transition of care summary, it's not going to give you a lot of really good information. Also, another thing to mention as well, whenever you're creating the transition of care summary or a clinical summary, if you ever get these error messages, which is a common question that we get, just read what the message says. This is going to tell you any missing information that's preventing that summary from getting created. So in this case, it's telling me my gender, my patient's gender and language is missing. I would need to, of course, change that and correct that in the patient profile. So from here, I think it said preferred language. So let's just close that out. Let's just try it one more time. And then here's another example too. So if I have, if this pops up again, now this message is telling me that I have incorrect problem in my problems tab. So you can see here there's no SNOMED code, which is also going to prevent from this being created. Third time's a charm. So you can see though that, and then now of course it successfully created the transition of care summary. And once again after that you're going to select upload. But you can see that whenever you do generate either one of those reports or summaries, once again just read what the message says and it'll tell you exactly where to go. So that's how you complete Objective 5. Now let's look at Objective 6. Now this is patient education. So this is, the objective is to use clinically relevant information from your certified EHR technology to identify patient-specific education resources and provide those resources to the patient. Now the measure is patient-specific education resources identified by your certified EHR technology are provided to patients for more than 10% of all unique patients with office visits seen by the EP during the reporting period. The exclusion is if you have no office visits. Now, in MDE, and when they say office visit, we're not talking about your comprehensive exams. So a lot of customers notice that when they generate the report, their denominator is rather low. And that's because that denominator, in order to create that denominator, you do have to have patients that have an exam with any procedure code that, let's say, is a 99 code. So you can see that any S codes, any 92004, 92014, those aren't going to count for your denominator. So it's specifically looking at those 99 codes, evaluation and management codes, or also known as office visits. Now, if you do have a patient, who is coming in for an office visit, then in the exam here, let's go to the assessment, you have this education checkbox. Now, you do want to indicate what type of education you did provide them, and keep in mind this education can be provided in any format. So you can provide it verbally, you can provide it by pamphlet, a video, any which way is absolutely fine. After you've selected the type of education, just make sure you indicate that it's actually been provided. And that will go ahead and give you your numerator. Oh, didn't mean to do that. Let's go to 7. Okay, so Objective 7 is going to be medication reconciliation. So this is actually going to be the opposite of transitioning a patient out. This is if you received a patient from another setting of care or provider. The EP who performs medication reconciliation for more than 50% of your transition of care in which the patient transitioned into the care of the EP. The exclusion, of course, is an EP that was not the recipient of any transition of care during the reporting period. A lot of providers, a lot of customers are the ones who actually transition the patient out to another care, and they don't really receive too many patients, so they can, of course, take the exclusion for this. If you are, though, however, the recipient of a patient, then what you do want to do is, starting off in the patient profile, you do want to indicate in the demographics tab which physician referred the patient to the office. This is going to go ahead and increment your denominator. Now, once this is done, you're going to go into the Health tab. We're actually going to go to Medications. And then on the top right, after you've reviewed their history and their medications, you're just going to select here, Reviewed. This is going to give you your numerator. Now, Objective 8. is patient electronic access. I keep doing that. There we go. The objective is to provide patients the ability to view online, download, and transmit their health information within 4 business days of the information being available to the EP. Now, this is broken up into 2 measures. The first measure is asking that more than 50% of your patients seen during the reporting period were provided with timely online access to their health information with the ability to view, download, and transmit to a third party. This has to be done within 4 days. Now, the second measure is asking that at least one patient seen by the doctor during the reporting period was able to download their health information. Now, you do have an exclusion here. Most customers don't really, can't really take this exclusion. Because the first one probably really doesn't make sense, to be honest with you, because the information that we create will always have the patient's name, provider's name, and office contact information. So that's why not a lot of people, not really anyone, can take that exclusion. And the second one just depends on your broadband availability. Now, in order to meet this objective, now this is going to require you to go into, have your patient go into their global portal. But starting off first, in the exam, and this once again has to be done within 4 days, you want to make sure that you go into the HL7 CCD CTR subtab of the health tab in the exam. Make sure that you create a clinical summary. After you've created that clinical summary, you're going to go ahead, and this is just going to give you a preview of what it looks like. You're going to go ahead and select Upload. Now, another thing that you'll want to do after this is, so up until this point, it's actually going to meet your first measure. Now, for the second measure, you are going to have to give your patients information for Global Portal, the website, their username, their password. You also want to make sure that they can actually log into it and they're able to download it. Now, and you only need to do this for one patient, keep in mind, for an entire reporting period. Now, some customers, they take a more proactive approach, so they actually do it for the customers, for their patients in front of them. I think this is a really great way to make sure that you're achieving this objective, especially if it's just one patient. So just take one patient out of your time and have them go into the global portal, because either way, you'll have to retrieve the username and password for them. And you'll be able to provide it to them and then have them log in at the same time. Now, after you've done that and after they were able to download it, then it's going to go ahead and increment your numerator for the second measure. Once again, this only has to be done one time. Now with Objective 9, this is also including the global portal, but much like the drug and drug interaction check just needed to be enabled. It's the same thing with secure messaging. So before they made these changes in 2015, late 2015, they used to ask that more than 5% of your patients receive a secure message. Now they took that away, so there's no threshold, there's no numerator, denominator. Now it's just asking that you have it enabled. The way that you have it enabled is if you enable Global Portal. Once you do have that enabled, then you also have this, and also to enable it, if you are cloud-based, you can always go into the company settings, and I'll show you where you can enable that. Local customers, you would need to contact our installs department. You can always email them at installs@myvisionexpress.com and ask them to enable Global Portal. The way that you'll know that it is enabled, if you go to Setup, File, Setup, and then Company, then we're going to go to Systems. Now on the right side here, in the middle of the screen, you have Global Portal. So if it is activated, you're going to see this guy right over here. If not, then it's going to say Register for Global Portal. Now once again, web-hosted customers, if you select that, then I'll go ahead and activate Global Portal. Local customers, once again, email installs at myvisionexpress.com. They'll enable it for you. I also want to stress that for those who are web hosted, if you do activate Global Portal on your own, you are now going to become the admin for Global Portal. Also, same thing goes for local customers. When Installs calls you and they install it, whomever you're logged in as, when they install it, that's going to be the person who's going to be the admin. When you guys do have that enabled and that admin has their username and password, one thing that you guys might want to do in Global Portal, there's security settings in Global Portal that are not related to My Vision Express settings. Make sure that your staff, the staff members that will be going into the Global Portal, make sure that they have all the rights or the rights that you need to, because admin has all the rights and any additional people won't have all admin rights, so they may be limited. So I do want to address that. Now, the last objective is going to be public health reporting. This one everyone really is excluding from because it doesn't really relate to their scope of practice. The objective is to have an active engagement with public health agencies to submit electronic health data from your certified software, except where prohibited in accordance with applicable law and practice. Now, there are 3 measures. It is going to force you, when you go through the attestation, to select 2 of the 3. If you exclude from 2 of the 3, it's going to make you pick a 3rd one. So essentially, everyone's going to be reporting all 3. Because that's just how they built the attestation. Now, the first one is immunizations registry reporting. Second one is syndromic surveillance reporting. And the 3rd one is specialized registry reporting. Once again, these exclusions, there's 3 different exclusions. And these exclusions can be found anywhere as far as when you look at meaningful use. So I'm not going to harp too much on what these exclusions are and the details of it. One thing I would do, though, if you are going to take the exclusion for it, this is unrelated to your scope of practice and you've never reported this kind of information before, I would contact still your local public health agencies. There should be a local one for every state. And I would ask them to provide you with some kind of documentation, if not them, then yourselves, to write a documentation on why you're taking this exclusion and that it doesn't relate to your scope of practice. Now, what about stage 3? In the 2nd week of January, CMS announced that it will be ending the meaningful use EHR incentive in 2016. So pretty much they're going to be ending meaningful use in 2016. Of course, there's not really much details after that other than it will possibly replace meaningful use or be tied to the implementation of Medicare Access and CHIP Reauthorization Act of 2015 and also include streamlining various quality reporting programs. So I wish I could give you guys more information, but I think I'm kind of in the dark until they announce further information. Until then, though, I would continue with your scheduled meaningful use reporting period, whether if you're a first timer for 90 days or your full year. Now, I want to end this presentation with showing you the meaningful use report. So once again, with the changes for meaningful use, they've changed the structure, so we had to change the structure of our reports. So in a build that's coming out today for local customers and next week possibly for web-hosted customers, you will have access to the new meaningful use report and also the clinical quality measures report. Now, if you go to File, Reports, when you go to Meaningful Use, you're going to see that now there's 2 additional options. Before, you could just go to File, Reports, Meaningful Use. Now we have Core Measures or CQM. So when we look at Core Measures here, it's going to give me my 10 objectives versus your core and your menu. This is a little bit of a glitch. Here are these 2 tabs. So typically you're just going to see this one tab, Objectives, to not add any confusion. One thing that we also did in the report, so if you look at this drop down here, now we have 4 reports. Before we just had stage 1 and stage 2. Keep in mind, stage 1 and stage 2 will be for the years that you participated in 2013, 2014. You have here 2015 stage 1 alternative. This is for stage 1 participants that were scheduled for 2015 last year, and that will include the lower thresholds and also the exclusions. 2015 stage 2, this is what everyone should be on, as well as any stage 2 participants from last year. So this is going to be the new report that everyone will be using. One thing I do want to add, when the build comes out, you do have to change this. You also want to make sure that you change this in your physician setting. That way it's matching the type of stage that you're on. So if you go to File, Setup, if we go to Physician Resource In-House, if you select a physician here, any one of these, on the right side there's a meaningful use stage and there's a drop down. So just make sure that for this year on, or at least for this year until they change it again, make sure that you select 2015 stage 2. That way you have the right report reflecting. And then as far as clinical quality measures, we're going to go to File Reports. We're going to go back to Meaningful Use Reports. We're going to go to CQMs, and then here are all your CQMs. All right, so that is it for today. I'm going to go ahead and open up the chat here. So if you guys have any questions, send me a message, and then I'll be able to answer. I already have some questions actually, so I'm going to start off with those. So for PQRS, you said for Medicare only, does that mean Medicare replacement plans too? So I know specifically they're looking at Medicare Plan B, Plan B patients. You know, anything other than that, I'm not too sure. I don't think that would fall under. What I would do though is to verify and make sure. I would call those Medicare plans, those supplement or those replacement plans, or anything that has Medicare on it, just to verify with them. Kind of hearing it from the horse's mouth to say, to inquire if they do require PQRS codes. Another question here is pretty much patients have wondered why their spectacle prescriptions are on the clinical summary. Is there anywhere to put that on there? You're absolutely correct. It does not have that type of information, which kind of goes back to me saying with that transition of care summary, kind of as per what CMS wants on that document. It doesn't really give you a lot of great information. I wish that it did have more information, but they kind of limit it as far as what you can put on there. Mainly it's just the information from the health tab. You know, it's something that we have inquired or looked at before, and we were hoping that when we get certified again, for stage 3, if it's even going to happen, that we were going to try and include more relevant information on the summary. And then another question here is what happened to direct messaging? I thought that was an objective. So secure messaging, that still stays, but direct messaging was for if you were exchanging a transition of care to another provider, and then part of the criteria, that measure or that objective in stage 2 was broken up into 3 different measures. The last measure was asking that you do at least test it, that direct messaging feature with another provider, but they've actually eliminated that. So that objective or measure in stage 2, now that's objective 5, and they just limit it as more than 10% of those patients to have that transition of care uploaded. We are going to be, one of the questions here is about the implementation of ICD-10 and then affecting the PQRS codes and not auto-populating. So with PQRS, so they added a couple new measures for PQRS. So we are actually adding more PQRS codes and also retesting the rest of those codes. So, if that is the case, if those ICD-10 codes, if they're not mapped properly, we're going to catch it during this process, and then we'll be able to correct it at that point. So after this, whole revisiting of PQRS and adding those new measures, we'll be able to correct any other possible errors. If you guys have any additional questions, please feel free to ask those questions. If not, I'll leave the chat open for maybe about like 2 more minutes, and then I'll go ahead and close the session. Thank you guys so much for attending. All right, so I'm going to go ahead and end the session. Once again, thank you guys so much for attending. If you guys have any questions, you can always contact us at support. You also do have knowledge-based articles that you can always review at support.myvisionexpress.com. And of course, this webinar is recorded and then will be posted in the next couple of days. Thank you guys so much. Have a great day.